ओम धम धन्वंतरे नमः। कर्पूरगौरम करुणावतारम संसारसारम भुजगेन्द्रहारम सदा वसंतं हृदयारविंदे भवं भवानी सहितं नमामि। Let me share. Topic is plaque psoriasis. Psoriasis is a chronic skin disorder where there will be inflammation of the skin and there will be plaque, formation of plaque with underlying areas of bleeding and hyperkeratosis, and also papillae are formed. So this is a chronic disorder. The treatment is prolonged and sometimes not effective. Sometimes we cannot cure completely, permanently, but some improvements can be seen by Ayurveda treatment. Especially Vamana and Virechana are found useful in conditions of psoriasis with the administration of Shamana drugs and Patyapatya. This is the psoriasis. In the hand, there is a psoriatic lesions. Psoriasis is a most prevalent immune-mediated inflammatory disease. It involves skin and, in some cases, joints and can be associated with abnormalities of other systems. Plaque psoriasis is the most common type of psoriasis. The activity reviews the psoriasis and its evaluation. Psoriasis is recognized as the most prevalent immune-mediated inflammatory disease involving skin and joints and associated with abnormalities of other systems. Plaque psoriasis is the commonest clinical type of psoriasis. Even though the condition is not life-threatening, it is difficult to treat and response rates vary widely. Plaque psoriasis typically presents with large, oval, circular plaques over the scalp, trunk, and extensor body surface. The plaques have an extensive amount of scaling due to the hyperproliferation of the epidermal cells. Most patients have acute flares and relapses of plaque psoriasis, which may sometimes become severe and progress into the pustular subtype. At least 15% of patients with plaque psoriasis will develop psoriatic arthritis. Arthritis means inflammation of the joints. When we see the histology of well-developed plaque shows compact orthokeratosis, parakeratosis, spongiform pustules, microabscesses with a neutrophil collection in the upper epidermis, acanthosis, elongation of rete with widened bases, suprapapillary thinning, and tortuous dilated papillary capillaries. Dilated capillaries and keratinocyte proliferation are the consistent features in all stages of psoriasis. So this is the lesion, psoriatic lesion. You can see there is a scale formation, isn't it? Hyperkeratosis, scale formation. If you remove the scales, there will be bleeding spots. The papillary thing, and there will be bleeding spots. The scales are waxy. or they are silvery scales. Yes, silver scales. You can see here in the hand. So there is a psoriatic lesion. Where you can see there is proliferation of the epidermis and hyperkeratosis, formation of scales, silvery scales, and below the scales, bleeding spots. The scales are removed, bleeds. Okay. And scales are, they are greasy. There is an initial lesion, the psoriasis, plaque psoriasis. Plaques form due to the overgrowth of the epidermis, and there will be silvery scales. This is again the beginning stage of arthritis. Plaque psoriasis. Okay. You can see the initial there will be reddening and areas of inflammation. Then there's a chronic one. You can see the back of the ankle, in the back of the elbow joint. You can see there is hyperkeratosis and scale formation. Okay. Example for plaque psoriasis. There in the hand, there is a skin lesions, chronic skin lesions. Scales are formed. Okay. Greasy scales. Plaques are formed. And below the plaques, there will be bleeding spots. The plaques are removed. There will be bleeding. Papilla. Another example for plaque psoriasis. You can see the lesion in the hand. Again, a patient of plaque psoriasis. You can see plaques in the hand, silvery scales, and if it is removed, there will be bleeding, oozing and bleeding. The other patient of plaque psoriasis. You can see in the hand there are reddish lesions that appear from, and they turn into the plaques, chronic inflammatory condition of the skin. In the scalp, you can see the lesions which are having silvery scale, plaques. If the plaques are removed, that can be bleeding or oozing. So everything will be present in this condition. The chronic disorder. This is also a plaque psoriasis. You can see the plaques in the back of the back, isn't it? So the plaques, they do overgrowth extra growth of the epidermis. There is another patient with lesions of plaque psoriasis. In the leg, you can see the lesions of plaque psoriasis. Plaques are formed, silver scales, and the underlying bleeding spots, inflammatory condition. Another patient example for plaque psoriasis. You can see first the later pustules will form. The infection is that the plaques are turned into pustules and they peel off. You can see the beginning stage of plaque psoriasis, the back of the elbow. Also, you can see, and there is the lesions of plaque psoriasis, inflammatory areas in the skin, plaques, and suppose infected, later condition, pustules are also formed. If the plaques are removed, there will be bleeding tendency there. Another patient with lesions of plaque psoriasis, chronic inflammatory condition of the skin. Another patient you can see pustules. So plaque psoriasis, when subsequent infection is that there will be accumulation of leukocytes in the epidermis or forming pustules. This is another patient of plaque psoriasis. You can see the lesion. The plaques are formed and there will be silver scales. The patient of acute plaque psoriasis. You can see the lesion. So, right, lesion is the chronic condition. The inflammation of skin occurs, takes off from, and scales get removed, get bleeding. The chronic condition, you can see the plaques, the knee joint. Suppose they invade the joint and there will be psoriatic arthritis, inflammation of the joints due to psoriasis. This is another, you can see a lesion of psoriasis. Okay? So there is a plaques are there. This is also a chronic skin disease, psoriasis, plaque psoriasis. In the back, you can see the lesion. There will be discoloration, there will be plaques, there will be inflammatory areas, there will be in later condition, if infection occurs, and pustules also. The scales spill out, and there will be the bleeding spots. The beginning stage of plaque psoriasis. Like in the back, you see there are lesions, wide lesions are there with silvery scales, plaques, and the reddened area, inflammatory areas of the skin, the epidermis. Another patient of plaque psoriasis. In the hand, you can see, the right hand, there are lesions. So you see in the hand, wrist, you can see near the wrist, there is inflammatory skin area is there. It is plaque psoriasis. You can see areas where there is blood scales are there, and the skin is also affected. This is another patient with the features of plaque psoriasis. You can see the small lesions, discrete lesions out of the skin, the back of the skin, inflammatory areas, plaques. See, so there will be itching, oozing, bleeding also will be there. Another patient of plaque psoriasis. You can see the skin here. Chronic inflammation is there. The plaques. Another patient where the plaque psoriasis is thin. You can see the initial stage of plaque psoriasis. So today we have discussed the commonest type of psoriasis, that is plaque psoriasis. Psoriasis, Ayurveda has a better role. In the modern medicine, they give steroids and other anti-inflammatory drugs. But in Ayurveda, we can give the medicines internally also with the Vamana and Virechana therapy. Vamana and Virechana therapy are found effective in psoriasis. And medicines like Puttagaja Kesari, that's Aragyavardhini Mati, Palatrikadi Kashaya, Khazirarishta, and Gugul Tiktaka Dhritam, Gugul Tikta Kashaya, Panchatikta Gratagukulu, Panchatikta Kashaya, Ushirasava, Sarivadhyasava, Dandanasava, and Agusudha Shekaravati, Pravala Panchamarasa, Mukta Panchamarasa, Pravala Pishti, Mukta Pishti, Pravala Vasma, Mukta Vasma, Kamaduga Rasa, Vedma. These are some of the Ayurvedic preparations which are found effective in management of psoriasis. Thank you for patience.